The data are beginning to come in about children and the likelihood of getting COVID-19. What does that potentially mean for reopening daycares and schools around the globe? We'll explore the science behind this in this episode of Shareable Science Beyond the Blog. Welcome to Shareable Science. Science you can share. We know in other respiratory illnesses, like influenza and whooping cough, that children are a main driver of infection. So they are one of the main routes that the infection is spread to others, other children and other adults. The data don't seem to suggest that that's the same path that the virus that causes COVID-19 is taking. So before we talk about what the data is telling us, an important point. The body of evidence around this is continuing to accumulate, but it is still frustratingly small. And I'm talking in broader generalizations here, but I recognize that there are individuals that you and I both know that are children who have been infected, who potentially have had serious symptoms and may even have passed away. So I don't want to minimize that truly is happening, but I'm going to look at this from a broader perspective. There are three key things that we want to know about the virus when we're thinking about its impact in children. And I've got each of those here on the whiteboard. The first is, what's the susceptibility? In other words, how likely are children to get infected? So data from the CDC gives us some really interesting starting points with this. In the United States, the percentage of individuals that are 18 and under, 22% of the population. The percentage of individuals that are confirmed cases of COVID, at least at the time that this report was prepared, in that same age range, 2%. So if the virus were equally impacting across all age groups, you would expect this number would be much more in the 20 range. Other studies have actually suggested that children have between a 1/3 and a 1/2 risk. They're 1/3 to 1/2 times as likely to be infected by SARS-CoV-2 as adults. And the lowest risk seems to be among our kids that are 9, 10, and under. So when you start looking at that 15, 16, 17, 18-year-old range, you still see lower risk than in adult populations, but that age group, that teenage group, is at a higher risk than the kids 10 years and under. So the data suggests that fewer kids are getting infected. Second question, what's the severity? So if you're infected, how serious is the illness among this age range? This is what we have the biggest body of evidence for. So of all three questions, this is what I am the most confident. This is what researchers are the most confident in talking about. You can look at rates of hospitalization, admission to intensive care units, and deaths, and they are all significantly lower among children than among adult populations. And in fact, a meta-analysis, a study looking at the published work and trying to analyze it in total instead of individual studies, suggests that 80% of known infections in children were very mild. This works in pediatric research. It was published in June 17th if you want to dig deeper into it. So again, the data suggest that when children do get infected, they have a milder set of symptoms. Now, there are two important caveats to that. Children that have underlying health issues, like type 2 diabetes or coronary cardiovascular disease, something that impacts the functions of their lungs, obesity, do seem to be at a higher risk of developing serious symptoms if they get infected. And there's this very rare, exceedingly rare disorder that's been linked to COVID-19, multi-inflammatory syndrome in children. This is a system-wide inflammatory response that happens weeks after kids seemingly recover from these mild cases of COVID-19. Again, very, very, very rare and very treatable, but it is an important caveat to this broader statement. Okay, question number 3. What's the transmission? How likely are kids to actually spread the infection if they themselves are infected? This is a really important question, and we don't have nearly the amount of information that we would like to be able to answer this. But based on what we do have, when we look at contact tracing and testing, it strongly suggests that children are less likely to infect others, to infect other children, and to infect adults. Again, that's very different from what you see with something like influenza and whooping cough, where children are the prime drivers of transmission. So if we take all of this together, it suggests that the SARS-CoV-2 virus has a lighter touch, again, in general, on our children, especially our younger kids, those our toddlers, our preschool, our elementary school age kids. That data has important ramifications in the broader discussion about reopening schools in the fall and what that potentially looks like. We don't have time to cover that in this episode of Beyond the Blog, but I will note that in any given school building, there are more than simply children in the spaces. You have a significant number of administrators and teachers and support staff that are all adults that face higher risks. We have to take that into account as we explore what a back-to-school plan looks like. If you want to dig deeper into this, and there are many of you watching that probably want to go much deeper, I would encourage you to take a look at these 3 references. Each of them provides links out to actual scientific papers, and you can dig to your heart's content. They're all written for a public audience. They all do a really nice job of laying out what the science currently tells us, not only here in America, but around the world. If you find this interesting, I would encourage you to share this with other individuals. Again, recognizing I am painting this with a relatively broad brushstroke, and there are clearly nuances and exceptions, just like everything else we talk about with COVID-19. I look forward to seeing you on the next episode. Thank you for watching. Take care.